Welcome to the Seniors Flourish podcast, where it's all about helping occupational therapy practitioners working with older adults be the best they can be. And now your host, Mandy Chamberlain.
Hi everyone, before we get started, I wanted to talk about Seniors Flourish's sponsor, Great Seminars and Books. What I really like is that their mission is focusing on geriatric rehabilitation education and training for clinicians, which, as you know, is near and dear to my heart. They have great live courses focusing on topics such as clinical orthopedics, cancer rehab, or even topics such as clinical neurology. There is a course for anyone looking for evidence-based practice and treatment ideas while working with the older adult population. These are definitely some topics that I am interested in, and I think you should check them out too. So head on over to seniorrehabproject.com/great and use my promo code SRP25 to get $25 off your next course. Hi everyone, welcome to the Seniors Flourish podcast. My name is Mandy Chamberlain. I'm an occupational therapist and I am the host of this show. Today, it's just going to be little old me talking about dementia and sleep problems. Big topic. I'm just going to try to make it simple, easy, and break it down a bit. But, especially if you're working in facilities such as a skilled nursing facility, home health, assisted living and those types of things. This is where we see a lot of those behaviors. I'm going to put that in quotes. If you can see my air quotes, we're calling it behaviors because behaviors isn't always a bad thing. I like to think of behaviors, air quote, as kind of more of they are trying to tell us something. They're not able to tell us what they are trying to express, so they are having these behaviors. So good, bad, or otherwise, they're just trying to tell us something. And it's our job to try to decipher what is going on, why, and how can we help them, right? So things that we're going to be talking about today is what is sleep problems caused by, specifically with patients that have dementia. And then how can we assess that? And then let's look at some ideas to help our patients that are not sleeping well so they can participate fully in the occupations that they can. And so ultimately, of course, our goal is to help them live life to the highest quality. Okay. So we want to help them live life to the fullest. And sleep is a major, major issue. For many people with all sorts of different diagnoses, but today we're talking specifically about dementia. So let's start off with why is this a big deal? Right? It's a huge deal. I can attest, as I have 3 young children, I do not get the best quality sleep. So I cannot imagine if I also had dementia or any other kind of cognitive decline. My behaviors and cognitive clarity definitely declines when I don't sleep well. So I'm more irritable and I'm more cranky. And why should that be any different for someone who has dementia? So, and then you have those other things that are associated with it. So, there is significant morbidity and mortality rates for people who don't sleep very well, decreased quality of life. There's increased symptoms of depression and anxiety, and we just feel terrible. And it's stressful for the person who is not sleeping well. But also, if it's someone that has dementia and they have a caregiver, that's increasing the caregiver stress. So it's not only the person who's not sleeping well having a hard time, it is the caregiver also having a hard time. So it's really important that we actually talk about sleep, talk about the patterns, and do an assessment so we can maybe give some ideas and really intervene so that everyone can have a better quality of life in general. Okay. So as we age, in general, our sleep patterns just change. Okay, so sleep chat. So things like as we age, we sleep lighter. We have less time in REM sleep, and even though this is normal to have sleep a little bit lighter and have less time in REM, this lighter sleep equals it's easier for everyone to wake up, right? So it's just one of those things that we really need to kind of keep in mind. So not only as we age that this is just a normal part of the aging process, then you have all the other things that people are dealing with when they have dementia on top of that. And so, also when we're aging, it changes our natural circadian rhythm. So it's very, very common for anybody older, earlier to bed, early to rise. And that's just actually a normal part of the aging process. So you have to kind of keep those things in mind. And then you have a lot of these chronic medical conditions. You have more medications. Examples, let's say you have COPD. Of course, if you can't be maybe sleeping flat on your back, you may be using a CPAP machine. I mean, there's so many things that can affect that sleeping. If you have something like, I'm trying to think of an example like GERD, you have that reflux, maybe that's waking you up, and then you're taking medications for that. And then you have the side effects sometimes from those medications, arthritis, or pain, chronic pain, anxiety. If you're taking medications, maybe like a diuretic, and you're taking it maybe at the end of the day or the quote wrong time of the day, and you're getting up to go to the bathroom more, or let's say you are having some alcoholic beverages before bed, thinking that's going to help you get to sleep, but actually the breakdown of the alcohol in your system really increases the chance for insomnia. So it's all those different things. And then when you have dementia or Alzheimer's or something like that on top of it, that disease process directly affects sleep on top of all those regular aging things. So the circadian rhythm is affected there too. And then there's actually some REM sleep disorders associated with dementia specifically. So it's like, those are the things you just have to really look at and pay attention to. And even though, like I said, it is normal, it does definitely affect your occupational and physical performance of activities, mental clarity, and like I said, stress. Okay. So we know that this is a normal aging process. We know that if you have dementia or Alzheimer's or something along those lines, you have an extra level of sleep difficulty. Okay, so what do we do about that? So we need to really look at assessing sleep. Okay, and so when I look at assessing sleep, I always go back to the word why. I use the word why all the time when I'm talking about our patients that have dementia, because I think if you use that one single word, it helps me look at the whole situation a bit more holistically. Why? So before we start bombarding our patients with interventions that we think might work, that we're not even sure will work, we have to look at why. Why are we using these interventions, and why do we find that might be a good idea? So let's just let's backing it up and figuring out why. And I'll kind of going to go into an example of how to use why to help assess for sleeping with our patients with dementia. So I found this amazing article from the Journal of American Geriatric Society, and it's evidence-based recommendations for assessment and management of sleep disorder in older persons. So they came up with a huge list of recommended questions to ask. And I'm going to read this list, so you might have to bear with me, but they're really, think about it. You're like, yes, that makes sense. Yes, that's a question you'd ask. Yes, of course. But I'll include the whole list in the show notes. But these are some really good things to kind of keep in mind. And so in the show notes, I put it together, the whole question list, and then like a space below it so you can kind of write in some answers if this is one of the areas that you really want to be assessing a little bit more thoroughly, if that's a problem. But here are the questions that they suggested through their research that you should be asking. And so, of course, you're going to be asking the caregiver, staff members, those kinds of things specifically. And they're great questions. So here we go. Ready for the list. Dun, 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 dun. Okay. Number 1, what time do you normally go to bed at night? Or what time do you normally wake up in the morning? Of course, you're going to be replacing the word you with your parent. if that's appropriate, or the resident, or your friend, or whatever. So what time do you normally go to bed? What time do you normally wake up in the morning? Okay, that's number one. Do you often have trouble falling asleep at night? How many times do you wake up at night? If you do wake up during the night, do you usually have trouble falling back asleep? Does your bed partner say, or are you aware, that you frequently snore, gasp for air, or stop breathing? Does your bed partner say, or are you aware, you kick or thrash about while sleeping? Are you aware that you ever walk, eat, punch, kick, or scream during sleep? Are you sleepy or tired during much of the day? Do you usually take one or more naps during the day? Do you usually doze off without planning to during the day? How much sleep do you need to feel alert and function well? Are you currently taking any type of medication or other preparation to help you sleep? Do you have the urge to move your legs, or do you experience uncomfortable sensations in your legs during rest or at night? Do you have to get up often to urinate during the night? If you nap during the day, how often and for how long? How much physical activity or exercise do you get daily? Are you exposed to natural outdoor light most days? What medications do you take, and on what time of the day and night? Do you suffer any uncomfortable side effects from your medications? How much caffeine, example coffee, tea, or cola, and alcohol do you consume each day or night? Do you often feel sad or anxious? And have you suffered any personal losses recently? Yeah, reading through them, you're like, oh yeah, those are great questions, but it's really nice to kind of have it all in a list. So I will get that to you, like I said, in the show notes. But I think you can get so much information from this. And what's really interesting is, of course, the person that has dementia may not be able to answer those questions, but even like a caregiver may not be able to really answer some of those questions. You're like, I actually don't know. Of course, I'm trying to think of an example, like maybe, uncomfortable side effects, or how many times do you wake up at night? Most of the time, the caregivers don't really realize how many times people are waking up at night unless they're getting up, or they're wandering, or they're falling out of bed, or there has a quote, like I said, behavior associated with it. So one of the other things I like to do with it, and I find this a little bit more specific, and I find it super, super helpful, is having the caregiver and or the staff fill out a behavior checklist. So if you're a member of the Learning Lab, it's already in the resource area, because as the members know, I like to use this for a lot of different reasons in relation to patients with dementia. I can use this to gather so much information. But basically what a behavior checklist is, it looks at the person's daily routines. So it has each other hour of the day listed, and then it has a column for the activity or event happening, and then the behavior associated. So with this, we can get a picture to see if there's any triggers or routines or any other information that we may need to get a clear picture of kind of what's going on. So I can think of every facility is different, and I know some are going to be so much easier to use this type of thing with or than others. And definitely some staff is going to be much more on board. So I usually talk to the nurse, and if this is a problem for the, example like the CNA staff, I can usually get the director of nursing on board and having them complete this behavior log for a couple days, just to get a good understanding of what the heck is going on with the patient, seeing what the routines are. And why this is helpful is, let me just give you an example. So let's say you have a patient that's getting up every night from like 2 to 5 a.m. They're awake. Okay. And during that time, they are trying to get out of bed on their own, and they are falling a few times a week. Okay. And so because of that, they're yelling, or they're agitated, or they're rustling through things, or whatever that associated behavior may be. And so on those days that they are just agitated at night, they're agitated during the day, and they are yelling more, and they are not cooperative, and they're not completing, let's say, any morning grooming. Okay, so that results in caregivers getting stressed out. They're worried that the patient's going to have poor hygiene. They're worried about skin breakdown, teeth falling out, whatever that may be. Okay, so sometimes if you have them fill out the behavior log, you can really, like I said, get a really good idea. So it's not just figuring out what's happening at night. Well, what's happening during the day? So let's say this same person, because the staff completed the behavior logs, find that they are sleeping from 9 a.m. to 11 a.m. every day and from 2 p.m. to 4 p.m. every day. And they are literally sitting watching TV most of the day. They don't want to participate in any group activities. And so they're just sitting most of the day and napping most of the day. So this is where I get back to why. Why are they having problems sleeping at night? Okay. So we went through the list of questions and we made some recommendations saying like, okay, they like to drink their Coca-Cola before bed. So we can make those modifications to the routine. Maybe they are on caffeine free before bed, if that's something that they always use or drink or, something like that. So we can get a lot of information from that questionnaire, but you can also get a lot of information from that behavior checklist. So looking at that, behavior checklist, like I said, we're looking at those routines. Okay, they're sleeping during the day, they're watching most TV, they're waking up at night, getting back to that why. So instead of just saying like, okay, the patient's getting up from 2 to 5 a.m. every day and they're trying to get out of bed. If you don't do a full assessment, you may say, okay, let's try weighted blankets. Let's try earplugs. Let's try to make sure that there's no lights waking up. Let's make sure the, housekeeping staff isn't, sweeping in front of their bed or cleaning the floors right in front of their room, during that time of night. But if we look at the why, even though those things may be helpful, yeah, it may be helpful if they're not cleaning in front of their room, or maybe we need earplugs or whatever that may be. Let's back it up and let's look at that daily routine per that behavior checklist and look at those answers provided that the staff and caregiver interview gave us. And then we can see why this could be happening and make an intervention plan from there. So with the example that I gave, some of the things that I may say like, okay, yeah, maybe a weighted blanket may be helpful, or maybe earplugs may be great. But I may look at and say like, okay, we need to get them in a better daily routine. They are sleeping 4 hours during the day and they are not getting outside. They're sitting watching TV all day. Are they understimulated? Do they need to be, do we need to work on some kind of sensory activities during the day? Like I said, their daily routine is basically non-existent. Let's have them participate in some meaningful occupations that can make them feel like they're living, not just surviving. Or maybe medication timing could be off, going through some of those assessment questions that we were asking earlier. Maybe they need to be taking some pain, medication before bed, or whatever that may be, something to talk about with nursing. Are they drinking too much water? Do they right before, 1 hour before bed? Maybe we could change some of those types of things so we can look at the why to make this a little bit easier for everyone. And that's what's, the thing about, I think, when we start documenting some of these interventions, if you, it's kind of my soapbox, I'm trying, but if you can do a lot of the work on the front end, get a good assessment, do something like a behavior log or whatever your assessment or evaluation process entails to get as much information as you can. The goal setting and the interventions come much, much easier because it's laid out in front of you. If you ask those assessment questions and they're saying, they're getting up X amount of times a day, they're getting hurt, they're doing what? You're like, okay, these are the goals I can establish directly from the assessment that we made. And so, just trying to figure it out. So what happens sometimes when we are doing some of the documentation, we're so worried that things won't work, and that's okay. And, if you listen to the documentation series that, I did with Cornetti and Kraft, and I'll link to that in the show notes as well, but they talk about this kind of exact thing. It's okay to use your professional, assessment of the situation and say, we're going to try this because, and we're going to give it X amount of time. Let's say we're going to try this for, 1 week with the, caffeine-free Coke before bed. We're going to have them stimulated during the day, help them participate in activities so they're only sleeping less X, Y, and Z. And then at the end of that time period, we can say, yes, it worked, or we can say, no, it did not. And this is why we feel it did not. And this is what our assessment of the situation is X, Y, and Z. And because of that, we're going to try this instead. And that is okay. As long as we are using our skilled service and our skilled intervention, we're okay. And we're doing a service to our patients that we are trying something, and it may work, it may not, but we are using our assessment skills and our observation skills and our skills as an occupational therapy practitioner to make a determination to keep going on the path we're on, or if we need to shift and adjust it to what our patient's needs are. So other things that are proved to work, that's backed by research to help patients sleep better, specifically that have dementia, is outdoor or bright light during the day. It helps normalize the circadian rhythm, and also light therapy is shown also to be beneficial to get that light on them. They need the fresh air. They need the light. I need the fresh air. I need the light. I feel, I need it at the end of the day if I haven't been out all day. It's important, and it actually helps regulate our days and nights. So that is something that we can be working on with our patients. Consistent evening and morning routines and consistent wake up times. So, consistent evening routine, you may take a warm bath before bed. We're not watching TV before bed. The bed is only for sleeping, or sexual relations is always kind of what they say is the rule of thumb with that. Anything else, lots of extra reading. And it's hard, especially if you are working, let's say, in skilled nursing, or any of those other facilities where they do spend a lot of time in their bed. It's hard to kind of get in those routines, but sometimes those are some little tweaks really make a difference. But waking up at normal times, it's like, when you were working all week and you just like, I just want to sleep in so late on Saturday morning, because you always feel so tired when you have to get up at 6 a.m. and then you wake up natural at 6 a.m. And I'm always like, no, I want to sleep in. Oh, but it's your body's way of normalizing your routine, and it actually makes you sleep better at night. And then using those environmental cues to sleep, such as making sure the room is dark, making sure it's super quiet. Like I was saying, as in the earlier example, maybe you have to have the cleaning people, housekeeping staff, clean in front of someone's room at a different time, or have them wear earplugs if that's appropriate, or, but it can be really challenging in a skilled nursing facility, and things like that. But trying to use those environmental cues to help with the sleep. I think the big thing, like I was saying, is making sure that you're doing the work on the front end with a good evaluation assessment, so your goals will just be easier. So here's a goal example that I have used. And this is not the end all be all of all goals, but let's say you do the behavior checklist, and you're talking to the caregiver, and they're saying they're waking up 7 nights a week. They're waking up 7 nights a week, and they're so agitated during the day that they won't, like I said earlier, complete their morning grooming routine. So example, because I already gathered the information during the assessment, a goal maybe patient will reduce waking up at night from 7 nights a week to 2 nights a week to decrease agitation during the day and participate in morning grooming routine independently. So that is an example of one that I had, that I did with a patient in home health, because they would, if they were in a good mood, they would do their morning routine. They can do it by themselves, and everything was, peachy keen. But when they weren't sleeping at night, that messed up the entire day. So just a little quick overview on our patients that have dementia and how we can help with sleep problems. Oh, I actually really like this topic because I really love getting into the nitty gritty of routines. And I think it's such an important thing to really look at the whole picture and make sure you're asking yourself, why is this happening? Why is this behavior happening? Why are they not sleeping well at night? And really looking at it from a holistic view and really doing those assessments, evaluations, asking those questions to get a good picture of what's going on instead of jumping in and trying to fix through, adaptive, just adapting the environment. Let's look at why and see if we can look at it a little bit more holistically. Okay. So I will be adding all those evidence-based resource links in the show notes, as well as the list of questions to ask to assess from sleeping from that Journal of American Geriatric Society. And then make sure you check all those out and use them. And if you have any questions about it, always feel free to email me at any time. And if you like this information, I invite you to check out the Learning Lab at seniorsflourish.com Learning Lab for tons of other evidence-based assessments, resources, and treatment ideas. Thanks to you guys so much for listening, and until next time. Hi guys, don't forget to check out the live courses from my sponsor, Great Seminars and Books. I love the variety of courses they offer, specifically because they are relevant to the populations that we are working with every day, older adults. And their topics include things such as home health, a specialty course of its own, and clinical implications of pharmacology for the therapist working with the older adult. So all these topics are relevant, evidence-based, and very practical. These are treatments that you can learn in the course and take back and use right away. So head on over to seniorrehabproject.com/great and use my promo code SRP25 so you can get $25 off your next live course.
This podcast is brought to you in partnership with the Senior Rehab Project at seniorrehabproject.com.